Hello, welcome to Taking Flight, RCC's campus talk show. I'm your host, Jerry Hunt, RCC's Director of Public Information. We are coming to you today from the beautiful atrium in the Owen Science Building, which houses our simulated hospital. And we're mixing things up this time with a guest host, Vicki Chitwood, Dean of Health Sciences and Public Services Technologies, who is interviewing her program directors.
Take it away, Vicki. Thank you, Jerry. Hello, I'm Vicki Chitwood. I'm the Dean of Health Sciences and Public Service Technologies here at Rockingham Community College. And today I will be asking and interviewing my program directors of health sciences. So I'll start with Sherry Thomas, who is my health science coordinator for workforce development programs. And she's going to introduce herself and talk a little bit about her programs. Go ahead, Sherry.
Hi, I'm Sherry Thomas. I'm the Health Science Program Coordinator here at Rockingham Community College. Right now we are in the process of looking at starting some more workforce development programs to offer to the community, such as dialysis technician and psychiatric therapy technician. We also have phlebotomy running currently, and it is 215 hours. Those students, once they graduate, they can go on to a credential with ASCP and work in hospitals and laboratories such as LabCorp.
And how many hours is that program, Sherry?
215.
Okay, and it includes classroom and clinical and lab?
Yes, it does.
Okay.
That includes a 100-hour clinical rotation in one of the labs, either a hospital or a LabCorp or hopefully Quest coming soon.
Okay.
We also have pharmacy tech. That class runs about 204 hours a semester. Those students that enroll in that class, they have the potential of becoming a certified pharmacy technician, and they'll typically either work in a hospital pharmacy or a retail pharmacy like CVS or a local pharmacist. What they do is they dispense medication and count medication out like under the pharmacist. We also have medical assisting that runs 390 hours with a 40-hour clinical rotation. Those students will potentially, once they're completed the class, they will go on to do the CCMA certification. They work in hospital clinics. That means on the outside of the hospital. They can also work in labs and doctor's offices. We also have cardiovascular technician.
We have a lot of workforce development entry-level programs, don't we?
And working on some more. Cardiovascular, most of those students, once they graduate, they can certify as an EKG technician or a cardiovascular technician as well, and they typically will work in a cardiac unit monitoring, or they'll work in a private office such as a pulmonologist office or a cardiologist office once they've completed and become certified as well.
Okay, thank you, Sherry.
Thank you.
Angie, would you like to introduce yourself and tell us about your program?
Yes, I'm Angie Pruitt. I'm the Program Director for Respiratory Therapy here at Rockingham Community College. Our program is a 2-year program. It's 5 semesters, and it's a combination of classwork, lab time, and also clinical. So clinical rotations through 13 hospitals in our area. Our students are exposed to floor care, ICU care, long-term care facilities, neonatal intensive care units throughout their time in clinical. We do have prerequisites for our program. They're biology 168 and 169, as well as chemistry 131 or higher. The other requirements for the degree you can complete while you're in the program.
Do you have a GPA that is required to get into your program?
Yes, along with the prereqs of bio 168 and 169 in chemistry, you also have to have a minimum GPA of 2.8 to come into our program.
Is your program a 2-year degree program?
Yes, it's a 2-year degree of an Associate in Applied Science and Respiratory Therapy. And our graduates, upon graduation, they have to take a board exam. It's actually 2. There's one that's a written exam, and then there's also a clinical simulation exam to complete your registry, to be a registered respiratory therapist. And then our graduates, once they're board tested and they have their registry, they can go to work in any local hospital. They can go in long-term care facilities and neonatal intensive care units, as well as home care.
And does your program have a transfer option to it?
Yes, UNC Charlotte now has what's called a 2+2. So you would go in with our 2-year Associate Applied Science degree, and you could go for 2 years at UNC Charlotte and have your Bachelor's of Science in Respiratory Therapy.
And you and our clinical coordinator have that degree from UNC
Yes.
Charlotte. And you both are graduates of?
This college. We're
This-
both graduates
yes.
of this program at Rockingham Community College, as well as the 2+2 program at UNC Charlotte. And the 2+2 part at UNC Charlotte is completely online, so it's something you could be working as a respiratory therapist while you complete your bachelor's degree.
And when you say your students go to 13 clinical sites, can you give us a little idea about how far they travel for those sites?
We do have 2 clinical sites located in Virginia, but where we're located, that's within an hour's travel from here, from the college. And we also have a clinical site in Asheboro, which is about an hour south of here. So there's an hour range all the way around, going north or south generally for our clinical sites.
Okay, well, thank you. And Crystal?
Hi, I'm Crystal Talley, the Surgical Technology Program Director. We offer a diploma and a degree of surgical technology here at the college.
Tell us a little bit about the degree.
The degree is a 2-year program once you meet the prerequisites, which is Med 120, which is a survey of medical terminology, and English 111. You may enter the program. You have to have a GPA of 2.5. Upon entry, if you get the diploma, it takes 1 year. The degree takes 2 years, of course.
And with the diploma, do you go fall, spring, summer, and in the summer you actually set for your certification?
Yes, so at the end of the summer semester for diploma students, they sit on campus for their certification exam, which allows them to work all over the United States.
And what
It's a national.
What types of jobs, I'm sorry to interrupt, what types of jobs do your students in Surg Tech, what do they, and where can they go to work at?
So most of our students, of course, work at the hospitals in the area, or
Outpatient clinics?
I was getting ready to.
Okay. Yeah,
So most of our students work at work at hospitals, day surgery centers, outpatient surgery centers. Trying to think of other places. Veterinarian offices, dialysis centers, endoscopic surgery centers. So there's a lot of different places they can work, or surgeons' offices even.
And in your program, you know, we have an OR here in the simulated hospital, and we have it's a really nice OR with a lot of instruments. So tell us a little bit about your typical day for a student in the OR lab back there when you're doing lab and getting them prepared to go to clinical.
So basically, a surgical technologist is the surgeon's kind of second pair of hands, and they're responsible for setting up the table and maintaining a sterile field. So during the first semester in the program, we teach them how to do that in the simulated hospital before we take them to a real hospital to work on real patients. So after they learn all these skills involved to keep a table sterile for each patient and assist the doctor, then they actually move their second semester and they do clinicals from January to July of that year. And they complete around 500 plus clinical hours at 15 different clinical sites. You don't get shuffled up to all 15, but we do have 15 clinical sites.
And they
that we
travel
use.
to Virginia also, right?
Yes, ma'am.
Yeah.
So they're traveling, usually the farthest is about an hour. So Navant Health, Cone Health, Sova Health, so North Carolina and Virginia also.
And you also have a workforce continuing ed program that you run with your programs with Surg Tech. Could you tell us a little bit about that?
Yes, ma'am. So we actually run central sterile processing. So all those instruments that they use during surgery have to be sterilized in a certain manner so that we don't share germs. So central sterile processing is where that is done. So they go in, they help maintain the instruments, the equipment for surgery, and run large machines that are responsible for making sure all those bacteria
are gone. Our program for Central Sterile Processing is a 10-week program. You have online studying that you do for the class portion, and then you come in for 2 days, and we do 1 day here at the college back in our simulated hospital, and 1 day touring a actual working central sterile processing unit.
And as far as I'm going to jump back to Surge Tech for just a second. Who was our first graduate from our Surge Tech degree program here at Rockingham Community College?
That would be me.
So you actually graduated from our diploma program and came back and the degree program. So as you can tell, our students stay with us and come back and run our programs, and I think that's just absolutely wonderful because they've experienced, these program directors have experienced life here at RCC, so I think that's great. And now we'll introduce Anita.
I'm Anita Manning. I'm the director of the nursing programs, and I'm also a graduate of RCC, along with half of our nursing faculty, so we all come back. So we have 4 different programs under nursing. The first one is the nurse aide, which is under workforce development. Those students will come for 13 weeks in a semester, 186 hours, and those students, when they are in class, they'll have class, clinical, and lab, and then they can go to work in long-term care facilities, hospitals. So there's a variety of places they can work, and then many of them use that credential to enter our associate degree nursing program. So the first nursing program I like to talk about is our practical nursing. That's a diploma that takes 3 semesters. So those students will go fall, spring, and summer, and they will have a clinical and lab portion along with their classroom. Most of those students go to work in long-term care facilities and clinics or physicians' offices, but there is a move on now to bring LPNs into the hospital. So a lot of those graduates are going into hospital settings now. Then the next program is our associate degree nursing, which we do require the CNA for that one. So our nurse aide students take our nurse aide program and then apply for our associate degree program, which is 5 semesters. So it takes 2 years to get the associate degree.
Let me just
Yes.
interrupt you for a minute. Is there any prereqs to get into your practical nursing and your ADN
Yes.
as you're talking?
Yes, all of our nursing programs actually have the same prerequisites. So biology, bio 168, 169, and chemistry 131 or higher. And that is specifically so our practical nursing graduates can come back to our LPN to ADN program and not have to take additional prereqs. And our GPA requirement for practical nursing is 2.5, and for our associate degree programs, it's 2.8. Now, our associate degree graduates will sit for an NCLEX. Both programs sit for an NCLEX, which gives them a license to practice nursing. And after they pass the NCLEX, they can go to work in hospitals. As RNs, they really have a lot of opportunities. Some can work from home as case management. So there's a lot of different places they can go to work. And then our last program is the LPN to ADN. Now this one is for LPNs who are currently licensed in North Carolina and have graduated from an accredited program. So the prerequisites for that are the same as the associate degree. The GPA is also 2.8. The only difference is it's a 2-semester program, so it's pretty intense, and all of the general education courses have to be completed before they come in.
And so their work experience and their license, we give them credit for some of our nursing courses,
Yes.
correct? For them to come into that program.
Yes, because they've already completed a 3-semester practical nursing program, and then they have some work experience. So we give them credit for the courses they would have taken in the beginning of the associate degree program.
Okay. And I would also like to speak about our EMS, our emergency medical science. We have Jason Collins is not with us today. He is the program director for that program. And we have a brand new curriculum program starting in the fall, and it is picking up with some students. We're really excited. And we also have a bridge program for those students in emergency medical services where the students are already, it's kind of like the LPN to RN bridge. They have prior credit for their paramedic and the EMT that they've already received, and they can come in and bridge over into a degree program. So as you can tell that this fall, with all that you've heard that we have offering, we're very busy building, but we're excited. We love what we do, and you're welcome to come visit us anytime. Thank you.